Representative Gilchrest, followed by Senator Wong.
Thank you, Mr. Chair. I'm in strong support of this legislation today. This bill is about ensuring that when women seek reproductive health care in the state of Connecticut, they aren't deceived in order to limit their choices. And we did hear testimony, one from a doctor in an area hospital, one from Hartford GYN, explaining their conversations with their patients who had been deceived at an area crisis pregnancy center. We also have information from a secret shopper report that was done that gives example after example of deceptive advertising and deceptive statements. And I think the reason we haven't heard directly from women who have had this happen to them is because of the nature of seeking an abortion in our current climate and our current culture. There's a lot of shame placed on women, a lot of blame placed on women. Women are actually physically sometimes under attack when seeking an abortion in our state and in our country. And so to not have women come forward is not too surprising. We've also been given website illustrations of deceptive statements that are being used at crisis pregnancy centers. And during our public hearing, we heard testimony from the ABC Women's Center in Middletown about how they have something listed on their website called an abortion reversal. An abortion reversal is not a medical procedure. It is not recommended by leading medical organizations. And in fact, a study had to be cut short because 3 women started hemorrhaging from this procedure. And when pushed on the fact that the ABC Women's Center had this information on their website, their executive director defended having that information on there and defended using progesterone for off-label use, which was incredibly concerning and problematic. And to me is the very definition of deception. This bill says that it requires that no limited service pregnancy center, otherwise known as a crisis pregnancy center, make statements concerning any pregnancy related service or the provision of such service that is deceptive. Saying that abortion reversal is something that women can have done and recommending that women use progesterone for off-label use is deceptive and it's dangerous. And it's one of the very important reasons why we need to pass this legislation today. Since people keep bringing up that we've heard this bill over and over, that is the process. It was introduced in 2017, it's made it out of committee, it's gotten voted on the floor of the House. After it got introduced in 2017, we began to see some of these crisis pregnancy centers change the way they advertise, which is a positive, but it also shows that a policy like this is needed. We also heard during the public hearing about the Connecticut Pregnancy Care Coalition that many of these crisis pregnancy centers belong to. That coalition was formed in 2017, again, after we first introduced legislation here in the Connecticut General Assembly. And it is my understanding from reporting on this Connecticut Pregnancy Care Coalition that they require their member centers to take a softer approach to crisis pregnancy help. But there are some crisis pregnancy centers in the state of Connecticut who will not participate in that coalition because they are not willing to sacrifice direct contact with women they find to be most effective in preventing abortions, which means they are going to continue using deceptive statements unless we pass this policy and put in these precautions. So to me, this legislation is about creating uniformity across the state and ensuring that regardless of the website that a woman visits or the crisis pregnancy center she walks into, she receives medically accurate information. And I would urge all of my colleagues to support this proposal today. Thank you, Mr. Chair.